I'm Todd, I'm Professor of Precision Medicine at the University of Oxford, here in the Nuffield Department of Medicine. And today we're in the Centre for Human Genetics, which is one of the units in the department. My interests are combining genetics, immunology, disease mechanisms, and taking that knowledge forward to the clinic for patient benefit and disease prevention. I have a focus on the autoimmune disease, type 1 diabetes, but I'm interested not only in autoimmunity and inflammation more broadly, but more recently in neuroinflammation. So high-throughput sequencing has many implications, and one of them is reading out proteomic analyses. So as I mentioned, mass spec untargeted proteomics has really advanced. And for me, I'm interested in very rare molecules in human blood, like interleukin-2. And for me, sensitivity and dynamic range of detection are crucial. So we've done a lot of work on Olink. We were one of the first users. Olink is operating in this centre very successfully. But more recently, over the last 18 months, we've been using NULISA, and that was triggered by a visit by me to Stanford Medical School, where I did my postdoc. And Stanford Medical School core facility was testing out with Alamar with Fremont, their headquarters, if NULISA did what it said on the tin. And Stanford were pretty convinced. I was emailing them, and on the basis of that, we contacted Alamar and said, can we work with you and be one of the first places in the UK, maybe even in Europe, to work with NULISA and bring the Alamar Argo platform into the centre. So we did an experiment. We sent samples to Fremont from our interleukin trial, our type 1 diabetes phase 2 trial. They did the assays and sent the data back to us. And the data are remarkable. Because it's 10 times more sensitive than Olink, and because the inflammation panel is so well chosen, all the key chemokines, cytokines, etc. are on that panel to be detected. And it's got a sequencing readout that we can now, with the latest sequencing technology, we can read out less expensively, quickly, accurately. The platform, the Argo platform, was installed in the centre. Processing the data with the NULISA platform has been pretty straightforward. Yes, we have lots of experience with other platforms, in particular the Olink platform, but because of the way the Olink data is analysed, we have a pipeline that works very efficiently. It's easy to analyse the data, and very importantly, as with most of the companies we work with, we want to co-develop advances in the technology and insights. And I must say that the Alamar Technology Department has been, based in Fremont, have been immensely helpful. So when we're trying to understand the behavior of a certain protein, for example, interleukin-2, they've been really helping in digging into the data and helping us understand the dynamics of that protein. And that's a special relationship which benefits Alamar and it benefits us. They also ask our advice about, we're making a new panel, John, what proteins would you like to put on that panel? So that defines our relationship with Alamar. It's co-working, co-developing, and as I said, the data are of tremendous quality. And I think for me, and the insights it's given to type 1 diabetes and the behavior of interleukin-2 therapy and the pharmacodynamics and pharmacokinetics, we would not have seen that with any other platform. So for us, NULISA has provided a breakthrough in our understanding not only of type 1 diabetes, but also the behavior and characteristics of low doses of interleukin-2 to improve the regulation of the immune system. Type 1 diabetes is a neuroimmune disease. So, and we're really working hard to write this up and submit for publication. But at the heart of the innovation is NULISA, the inflammation panel.